All right, so today we're going to talk about what to do if you hurt your knee and you have insurance. So this has been an issue for quite some time. I'm seeing a client and I let them know that they have some kind of damage to their knee, and I suggest that they get an MRI. And I just realized this is probably going to be several parts here. I'm going to have to break this up. So, first of all, one of the sort of branch points here is, do you have insurance? So if you have insurance and you want to use your insurance, one thing that you should know, sometimes your deductible for an MRI of the knee might be more than the cash cost of an MRI for your knee. So let's put some numbers here. Let's say, and prices have been coming down. So let's say your deductible for getting an MRI for your knee is $550. It could be that if you call around and you ask for a cash payment for the same MRI, it could be $350. So I know that's not fair. It sucks. We're all in this boat where we are paying every single month for insurance that we don't want to use. And even if we do use it, it's usually not for something that we want or something that we need. So that's something worth checking out. Make sure that your deductible is not more than the cash pay for the same study, for the same MRI. Okay, so you hurt your knee, you have insurance, you want to use your insurance in order to get an MRI to see what has happened inside of your knee. Normally, you're going to go to your PCP, your primary care. Now, your PCP may or may not know very much about the musculoskeletal system. They may not know a lot about the knee, unfortunately. The musculoskeletal system is fairly specialized, and it takes usually extra training in order to learn enough about the different areas of the musculoskeletal system in order to be proficient. The ideal situation is your primary care doctor is also sports medicine, or your primary care doctor is something called OMM, or manual therapy, if they're a doctor of osteopathy. So those are the two ideal situations. It doesn't happen very often that your primary care is also specialized in sports medicine or the musculoskeletal system. So let's say you walk in, you can kind of tell you're getting the runaround, or you can kind of tell they don't really know a lot about your knee. The way you're going to know that is they don't examine you. They might look at it, they might ask you if it's swollen, or they can't tell that it's swollen. They might ask you if you've had some bruising, or what you did, or how long ago, but you don't really get a sense that they really know what's going on. Number one thing is to say that this is affecting your work. I'm going to say it again. Number one thing is you say that this is affecting your ability to work. After that, you can say how much pain you are in. Third, I would say, is that you can't sleep because of your knee, and then that is affecting your work. So for whatever reason, this all comes back to work. It's affecting your ability to get your paycheck. And primary care tends to listen to that. And what you're going to end up getting is, more than likely, you're going to get either a referral to orthopedics, or you're going to get a referral to sports medicine. And from there, once you see them, they get a chance to take a good history and to examine you. From there, that's when you're going to get that MRI. Now, let's say you get the MRI. Does that mean that you necessarily have signed up for surgery? No, it does not. One of the questions I get is, if I don't want surgery, should I still get an MRI? And I say that depends. It depends on what your goals are. It depends on what you want to be doing and how soon you want to get back to doing it. I look at an MRI as extra information. The examination, if you do a thorough examination, you're going to get 80 to 90% of what you need. The MRI is going to give you some of those finer details. So when I examine you, I can tell, is your ACL intact? Did you injure your MCL or your medial collateral ligament? Did you damage your meniscus? Did you damage your meniscus in several places? So these are different things that you can pick up from an examination. But that MRI is going to give you detail, and it's also going to be helpful for if you are doing any kind of regenerative therapies, because a year, 2 years, 5 years from the injury, you can get another MRI and you can compare it to that original one that you got when you were injured. So let's end it there. And I think that's good enough information. What it boils down to is you need to say, hey, this is affecting my ability to work. You know, I'm concerned about my job. I'm concerned about my paycheck. And usually that just kind of just sinks through and it gets you the referral. For some primary cares, they're able to actually get you that MRI right away. That's the ideal situation. And ideally, it's not costing a lot. So walk away points, make sure that you're not paying more for your copay than you are for the actual cash-based price for the MRI. And for two, when you go in to see your primary care doc, you know, just be ready to say, you know, I need this. This is affecting my job, and I'm worried. I'm concerned. I need to have some kind of imaging so I can know what's going on with my knee, so that you know whether or not you need to see a specialist or to get some kind of intervention. And ideally, depending on what that MRI shows, ideally, you know, if everything is intact, you know, maybe you've got some tears, but the fibers are still intact. Maybe you tore your meniscus, but it's a peripheral tear, meaning it's towards the outside. You still have range of motion in your knee. I highly recommend you start with regenerative techniques rather than going to steroids, and definitely surgery is the last ditch. You want to try to do everything else except for surgery. Save that as the last ditch effort. All right, that's good for today. Hope that was helpful. Hope you got something out of that, and I'll see you next time. Bye-bye.